Well, thank you everybody for joining me today to talk about community health workers at the Mid-America Regional Council's Head Start program. And we'll start by ask you to introduce yourselves and tell us just a little bit about what you do. So we'll start with you.
My name is Sandra Reese Tinsley. I'm the health manager for Mid-America Head Start, and I oversee health services for our grantee.
And my name is Alma Rivera, and I'm a community health worker here at Mid-America Regional Head Start.
And my name is Bridget Smith. I'm a community healthcare worker for Mid-America Head Start.
All right, thank you all. So we're going to talk just a little bit first about the course that you all participated in. Ask you to just share a little bit about how you found out about the course and what your experience was like with the course. And Alma, if you would share first just a little bit about how you found out about the course and what was your experience like?
So I was introduced to the community health worker course through Lynette Fowler.
And Lynette is the Family and Community Engagement Manager here at MARC, is that right?
Yes.
Yes.
So I received that invitation as a Head Start parent to attend the community health worker course, and it was a commitment that I took for, I think it was 8 months in total, every Saturday. The course went over a lot of different topics as far as what made a community health worker, and I didn't think it was challenging because it was something that I like. I love people. I love the community. I've been involved in the community because for my children attending Head Start, that was part of my community. So I didn't think it was challenging. It was just a time commitment because at the time my son was young. It was a lot of support in teaching us about the resources available to the communities. A lot of things that I didn't know that were available, and
So that then you're able to connect families to those resources through the work that you're doing.
right now, yes, because that's what I do. But I started out with myself. As I was attending the course, I have a really bad eyesight, and I didn't know that there was an organization that helped with the glasses. So I even came from taking the course because I was able to advocate for myself and seek a resource to help me.
Oh, that's great. I didn't know that.
Well, for me, the course was kind of scary. I know about the community and everything, but the more detail of it was what was important. And I didn't realize that I was in poverty, so doing the community healthcare work helped me see that I can help somebody else get out of poverty as well as myself. And going into the community is that you gotta reach one to teach one to help everybody come up together as a team. So that's what I learned as doing that in the community and being a a community healthcare worker. I always say CHW, so forgive me if I ever say that. It stands for community healthcare worker. But to me, I wasn't, it was just challenging because I didn't do what everybody else did. Had a high school diploma at the time. I did mine like a year before I became a community healthcare worker. So it was all like, oh, school, I don't think I can do it. So when I got halfway through the course, I was like, I'm leaving this. I can't do it. And everybody just kept encouraging me, you can do it, you can do it, you can do it. And I was like, oh man. So every Saturday I would leave. I'd be like, man, I'm leaving this course. I'm not going back. But I remember the teacher telling me, if you quit now, how can you help anybody else? And I just stuck with it. And I had to sit next to, well, I didn't have to, but I sat next to actually my supervisor now, which is Miss Sandra Reese. And I was kind of nervous every Saturday, like, man, I'm sitting next to her. What am I doing? Am I, doing this right? And was worried. But the whole time she was like, no worries, whatever you may need, I got you. So I was like, okay.
Isn't that nice to hear?
I would say, additionally, to what Alma and Bridget have already mentioned, the course also provided opportunities for them to go out and visit community agencies where they would learn about the agency, the services they provide when the services are available. We also had opportunity, we were required to go to various culture organizations and learn about that, and then experience culture diversity, experience. So like Alma and I went to a church, an African church, for the first time, and we were able to just understand how they worship and fellowship, and so that was great. We also learned about interviewing skills, and then understanding your role is that you're not there to be a nurse, but you're there as a trusted member of the community to support families with meeting their goals, their health goals. And so we learned about that, and then individuals also had an opportunity to participate in the diabetic portion of the Community Health Workers Program, where they learn about just how to work with people who were diabetic.
Do you feel like this really prepared you for the work that you all have been doing? Because you two now have been community health workers. This is your second year as a community health worker. And do you feel like the training that you had prepared you for what it is that you're doing now?
Yes. I would say that going to the course prepared me, because now I'm able to reach families and I can tell them I was a parent like them. Just speaking from my own experience, letting them know that, hey, I had challenges, things were hard, and just telling them how I had to do the same thing that they're doing, whatever that may be. If that was not having money to have transportation, or calling the Medicaid card, trying to get to the doctors and get appointments and everything set up like that. So I just let them know about those challenges that I have faced, and when I tell them that, they be like, oh, you serious? I'm like, yes, this is how it works. And I just let them know, and they just say, oh. So, and we work on those things together. So I let them know I'm available, dependable, and accountable. So if they want to go to the doctor, and if you don't have insurance, well, let's see what we can do to get you that insurance that you need, or whatever you may need, or whatever is keeping you from getting to where you're trying to go to.
So the course really, it really prepared me to reach out families in a professional way, and then as far as respectfully and advocating for them, not as as a trusted community member, and making those relationships with others.
What is a typical week like? And I thought perhaps, Sandra, you might share a little bit about how the community health workers' time is organized, and kind of what their typical tasks are, and even if there is such a thing as a typical week, kind of what is it that their day looks like?
Sure. So the community health workers work with the health coordinators and with the Tier 1 and Tier 2 programs of Mid-America Head Start, and they provide services for targeted families. As Bridget mentioned, they can support the family with activating their insurance or reinstating their insurance. They support the health coordinators with completing health screenings, such as hearing and vision screenings. They support programs on site when we have maybe a dental provider or someone from the health department to provide on-site services. And so their work at the sites depends on what the site's needs are. And so then they may provide, gather resources for that site based on maybe the site needs information regarding where to refer a family whose child has multiple caries, and the dental provider is not in that area. So they may gather those resources. And so it's targeted based on that site. They also support one of our health coordinators with 2-week postpartum visits. And they work with that health coordinator to complete the 2-week postpartum visit for our pregnant moms who have just delivered. And so I would say that there's no typical work week. It is based on the needs of the program and the needs of the families that have been targeted by that program that needs the additional support and or resources. Also, the community health workers, they do car seat safety education, and they install car seats for targeted families. And so yes, they support those families with meeting the health requirements. They're able to go that extra mile, whereas maybe the family support staff may not be able to, based on their work schedule,
Sure.
be able to go to a doctor's appointment with a family. They may not be able to support them with reactivating their health insurance. As Alma, I'm sure she'll probably share how she worked with one family and taught them how to ride the bus to their doctor's appointment. So it's those things that maybe that the family support staff may not be able to do, that the community health worker can do to ensure children have a medical home, a dental home, and that they receive the services. And if they have challenges with understanding any kind of a chronic health condition, that they can support them with, okay, here's who you need to talk with, and how can I support you? I will walk with you. And so it's like they're a trusted member because, one, as they said earlier, as Bridget and Alma said earlier, they were former Head Start parents, and so they know what the health requirements are, and they can share with families what their struggles were.
So one of my success stories is the most recent one. It's I went to do a car seat safety installation at a home visit, and the mom was she's an immigrant from South America, and one of her challenges as well was the language barrier, and the family's in need of a lot of health requirements. They don't have a medical home. They don't have a dental home. And as I was speaking to the mom, I was more listening to as far as the needs and the concerns she had, and how she felt unsupported. I remember feeling that same way, even though I have not had the language barrier. I knew the advocate piece for her, like that it was okay, like. I had to share from my step that it was okay for her to ask for help. That's what the community was for, and that the community that those exact places or resources were with that intention to serve others. So I received the consent for the family to want my help to help them advocate, and I was able to get them the resource for them to have the entire families getting a dental appointment. I was just advocating for the children, but then the resource offered to give it to the entire family. So for me, that was a success for them, and I was really happy that was given to them. And so as I worked with the family and teaching them how to ride the bus, it was also quite an experience for me because I didn't know how to navigate the bus system. So I learned with them, and it was learning for both sides. It was really humbling for me because they trusted me to do something that I did not know how to do, and it even became, she felt really entrusted to tell me that we were going on field trips, so that we could get her children also like wanting to do the activity, the doctor visit activities without feeling like, and it was, I really enjoyed working with that family because it was our field trip days.
Well, I have two experience that I would call a success story, I think. And it's because to me it's important to have health insurance. And I'd be so shocked that they don't have it. I'd be like, what? But as I helped the family, she had been off of Medicaid for a while, and her kids needed some physicals and some shots, and kid had a chronic health issue. So we were able to get that taken care of, and I kept telling my supervisor, well, just hold on, I'm getting it, I'm really close now, just hold on, I don't want you to pay for it just yet, I'm gonna get this taken care of. And actually, we got it taken care of. Swope was able to help the family get reinstated. I took the family down, well, we caught the bus down there and took out the paperwork, and we sat there, I met the family there, and we got the paperwork done, and then the paperwork came back, and we were able to call Children's Mercy to get them in to the clinic to be able to get their physicals and everything completed before the Medicaid had kicked in. So I was real grateful for that because they back paid it for some months. 3 months, they said. So that was a success story. But what made it a big success is that I made the family a promise. I'm available, accountable, and dependable, right? I had to make sure that I was there to get the family up for when the ride came. When I got them up and they was ready, the ride came, we loaded them on with the, I put them in car seats and everything, we got them loaded. I rode in there with them just to show them, hey, we're gonna do this together as a team. So we got there, we went to the hospital, we went across the street to eat lunch together as, you know, just doing a family outing because we had so many kids that needed the physicals that day. It was really a pleasure to have the mom to have that much trust in me to make sure that we took care of everything that we said we would do. So she was really excited. She said, you really did it. I said, yes. And I didn't even really have a clue how we was going to do it, but it worked. And so we came back. So we spent all day at Children's Mercy, all day long. And my supervisor called me, said, well, Bridget, I'm here. I said, yeah, we see you. We going to lunch, though. She said, where you going to eat? We going right across the street for $1.50. She said, $1.50? I said, yeah, I already did our resources because we're here all day. So we had everything that we needed for that day planned out. We had snacks. We had everything. I don't know. And it was really exciting to me. And I was really pleased with it. So we did that. So that's my first success story. But I also had a family that didn't speak no type of like English. And it was a language barrier. And we had to go down and get all the information and take it to them. And as we took the information, all she could do is keep smiling at me. And I was just like, oh, okay, we getting this taken care of. And she was so pleased. She kept trying to offer me everything. I said, all you can offer me is that you did the right thing, we doing it, and you're successful. And she got her Medicaid as well and what she needed for her family. So I was excited as doing my work as a community healthcare worker. It touched me.
I would say that Bridget and Alma have been truly a blessing for the Head Start Health Program. That's just two examples that they gave you of the success of how they have interfaced with families within the Head Start program, and they do a tremendous job with making families feel comfortable so that they will be able to trust them, to follow them. Even if they follow them blindly, they are able to make that connection and to share with families their own experience, knowing that their experience may not turn out as the community health workers, but nonetheless, there's their experience and they're there and they're available. One of the successes also is, as Bridget mentioned, this year in the state of Missouri, over 100,000 children were disenrolled and Medicaid, and they have worked diligently to support families with reactivating their health insurance, which supports us with meeting the Head Start health requirements, such as the medical home, the dental home, and completion of physicals and dentals within the required time frame. So they have been helped us to be successful with meeting those requirements.
Wonderful. Thank you all so much. And hopefully this is helpful to others who may be interested in employing community health workers in their own programs.